Yeah, so health insurance doesn't equal health care. The easiest thing to say is when you get sick, are you going to pick up the phone and call your health insurance company, or do you need to actually call a doctor? And most people will kind of laugh and chuckle, well, no, I need to go see a doctor. Great. Let's start right there with establishing the fact that a doctor provides health care. Now, just because you have health insurance doesn't mean they're going to get you in there when you actually need them. Most people wait 3 weeks to go see a doctor. What good is it if I'm ill, missing work, missing life, unable to spend time with my kids, and I can't get in to see a doctor to help heal me or tell me what I need to do or where I need to go? That's where most people get themselves into trouble, because they delay care or they put off care. And that is a huge, huge problem in the US, because if we're sick, we usually try to tough it out. Sometimes that works, sometimes it doesn't. If we can't tough it out, we go to an urgent care.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Well, thanks for joining us for another episode of American Potential. You know, today's guest grew up in and around a doctor's office because both his parents were physicians, and he thought that was a field that he really wanted to go into. But after he talked with other professionals, he decided not to pursue it. He heard about the struggles that providers were having and how those struggles took the joy out of the profession. So he and his brother started thinking about this problem and how they could help solve it. Well, after some brainstorming sessions, they came up with a solution and started Freedom HealthWorks, which helps doctors provide direct primary care to their patients. Now, providing health care in this way allows the doctors the freedom to practice medicine without interference, while also giving them the opportunity to live the lifestyle that they want to live. Now, while running Freedom HealthWorks, the brothers saw another problem they could help with so that more doctors would be interested in offering direct primary care to their community. I want to welcome Chris Habig, who is co-owner of Freedom HealthWorks and Freedom Doc. Chris, thanks for being with us.
Jeff, I appreciate all the kind words. It's a pleasure to be here.
All right. Yeah, it's great to have you. And, you know, we've done a couple of shows, I think now, where we've talked about direct primary care. We're going to talk a little bit more about that today. Before we get into it, though, I have to ask this question. Monica did a pre-interview with you. Says when you and your wife met, you connected over having broken noses. That's a pretty good story. I got to hear that one.
It's amazing where you go on your first date. And I wish I remember the lead in to that. My wife is a twin. And so both of ours were very environmental. Hers at a much younger age, in the womb, and mine through the course of having older siblings and backyard basketball hoops and everything else there, and grew up playing soccer. And I was usually the tallest person on the soccer field. And I would come in contact with other people's heads a lot. So it was one of those things where it wasn't a badge of honor necessarily, but one of those kind of fluky things where you're like, this is interesting. We have a lot in common, all the way down to kind of minute details about our noses.
That's good. That must have been an interesting, kind of first date, right? Talking about that and coming to that conclusion.
Well, there was a second date, so I think it was a good conversation. I'd consider it to be a win in my book.
That's right. Well, it sounds like it was a win. Obviously, it turned out well. So, well, great. Well, now you come from a medical family, as I mentioned. When you were growing up, tell me what you thought about the medical field as you were a kid.
I had a lot of misconceptions based off of direct evidence, which is kind of an oxymoron right there. I was the kid whose school bus would drop me off at my dad's physician office at that point in time, a small suburb north of Indianapolis. And I'd walk in, 2:30, 3 o'clock when school was done. And I'd go do my homework in my dad's back office, and I'd interact with the nurses and the patients. And it was a community that knew us and knew my father. And that's what I thought all physicians did. Growing up. And so it wasn't until undergrad where I realized that my dad in that kind of small town doctor feel was quickly becoming the exception and not the rule. This whole Norman Rockwell idea of house calls, like that kind of stuff, it was gone. And so when I got up there to kind of, tongue in cheek, pursue the family business, I didn't really meet any happy physicians who said, yeah, Chris, medicine's a good idea. And it wasn't until, my parents finally said, look, Chris, it's a great way to make a living, but we wouldn't choose to go back to medical school again if we had another shot. And I'm thinking, well, there goes that dream. I remember the day I shut my MCAT study book and said, I got to find something else to do with the rest of my life.
Yeah. So, I mean, what did they say other than, look, you ought to reconsider this? I mean, what did they say that really changed your mind? Just, was it the growing, like, sort of burdensome regulations and dealing with insurance companies and government reimbursement rates and all that stuff?
Yes, emphatically. It sucked the pleasure out of it. It sucked the fun out of being a doctor. Right. There's this kind of an old saying that you hear a lot, that if you love what you do, you never work a day in your life. And I kind of thought that, well, wait a minute, physicians love being physicians. It's a calling. It isn't a career, yet so many of them are miserable, but they can't think of doing anything else. There's some kind of disconnect with that. And so what I always add is, if you love what you're doing and you're able to actually do it, then you never work a day in your life. And so when reimbursements decrease, your overhead goes up, there's 5 or 6 full-time employees per physician. The margins in the dollars were being compressed so much that they had to see more and more patients. Everybody lost in that type of a medical arrangement, including my parents, who were like, you know what? I wouldn't go do this again, because hospitals have consolidated so much that we are very well-paid data clerks, and there's zero job satisfaction in what we're doing on a day-to-day basis. Yeah.
So you and your brother, you were kind of brainstorming about how to improve healthcare access. And so what were some of the things you saw as barriers to healthcare access?
2 words. Okay. Insurance. Yeah, first was insurance, and the second one was government. And so we put those up on the whiteboard, and we're like, well, what else? And nothing really came to mind, because those two, monopolistic behavior in the industry and over-regulatory environment stifles innovation. And so then we did our best Ghostbuster logo impersonation, and we drew the big red circle and the slash through it, and we said, take another beer and figure this one out. How do you create a healthcare business model where you don't have to interact with the 2 biggest barriers to innovation that Americans have ever put inside of an industry?
Yeah. Well, you talked about your dad being a doctor and being able to do, home visits and things like that. And really the changing environment. What made that change? I mean, it does seem like it is those 2 things, right? Health insurance companies themselves and the government that created these barriers and kind of have, I won't say ruined healthcare, but ruined it as a profession, at least in your eyes, right?
Oh, absolutely. And it's ruined it for patients. Right. Too many people confuse health insurance premiums for actual healthcare dollars. And so we give away T-shirts at every conference we go to that says insurance does not equal healthcare. And we're sold out within like 30 minutes of, getting out, taking these shirts outside the box. It's a mixture of factors. I think that we need to open up healthcare services and bring more free market principles into it, because that's really where competition thrives. That's where transparency goes and lives. And when that happens, consumers win. I like to tell people that healthcare right now is really a monopoly. We see hospitals forming monopolies. We see insurance companies forming monopolies. If I'm a monopolist, I love it because I win. And I'm the only person that wins. Everything else, everybody else loses. And so with a lot of antitrust, the lack of antitrust regulation, I guess, coming from the government, that would be one thing they could do that actually help things out. But you see burdensome regulations, and then you got EMRs, and you've got reimbursement, and then you've got Medicare, and it's just like, this is crazy. Why are we doing this to ourselves? It's healthcare and then education are the 2 most broken industries in the United States, because they are the farthest away from those free market principles that allows everything else to thrive and allows so many people to rise out of poverty that, for all of human it followed us around as really a species.
Yeah. Well, and it seems like the more people try to fix it, the more government tries to get involved and fix things, and politicians, and the worse it gets. I mean, that's essentially the problem. And I want to talk a little bit about direct primary care. But before I do, I mean, we've talked on this show a lot about the different free market reforms. There's no silver bullet. Like one thing won't fix healthcare. And I think that's been the way the left has talked about it a lot of times is, if you just pass, they would say if you just pass Obamacare, that'll fix it, or we need a single payer system and that would fix it. That's not the case. And there's no one single solution on the free market side that would fix it as well. Do you agree with that?
Yes. From a political standpoint, all politics are local. From a healthcare standpoint, all healthcare is local. When we have a fifth of our economy built on the interaction between one patient and one doctor, there's going to be a lot of, thinking that should be done, I should say. There should be a lot more thinking that it's done, because everything in that, again, 1/5, like a massive amount of money, is between two people. Now, when you start adding everything else into there, now you have health plans, and now you have administrators, now you have all these, government officials. When you try to apply this one-size-fits-all process or solution to a country that is not homogenous by any means in a population, it just doesn't work. And when you have different cost of living across this massive country of ours, you should allow people to innovate at the ground floor, because that's where the fastest, I say innovation, meaning if a treatment is out here and I don't need to go get approval because I'm able to do this and the patient wants it, and we can really get to our path to goal is really condensed right there. That's where innovation happens, not at some big bureaucratic hospital where, again, the doctors are all commoditized because they have a stethoscope and a white lab coat. Now, am I a fervent believer that the free market can solve everything on the healthcare side of it? Yes, but not tomorrow, because there's so many entrenched things that if we just flip the switch, there'd be a lot of problems happening. Now, we already have safety nets. That's why Medicaid exists, right? We already have a lot of these safety nets. And a lot of people would say, we already have government-run healthcare and it's not working for everybody. So we need to introduce more competition and free up physicians to actually provide services that are affordable to their patients. One of the biggest things that surprised people when I talk to them is regarding Medicare. We have our physicians opt out of Medicare when they switched over to direct primary care because they're providing services for a much more affordable cost than what Medicare reimburses. Okay, so if they were accepting Medicare, that would be fraudulent against Medicare because we are providing services for less than what Medicare pays out.
Below their reimbursement rate.
Correct.
Yeah.
And that usually blows people's mind. I'm like, if I'm a doctor and I have a Medicare patient come up to me and I say, you know what, I'm going to do these services and I'm not going to charge you anything because it's my birthday or your birthday, whatever it is. I just defrauded the government of the United States. I just committed Medicare fraud. And so you had these apathetic doctors, going back to our original point, you have these physicians who are, usually are most educated, are most apathetic, and they're just very intelligent people who want to take care of everybody else. They aren't allowed to do that. And that is at the core of the problem where these intrusions happen. And you have a lot of roadblocks into patients seeking healthcare, which leads into a lot of different problems when people delay or put off care at the same time.
Yeah. Now we've covered on this show before direct primary care, but for those who maybe didn't hear that episode, let's talk about direct primary care and just kind of maybe you can give a simple explainer as to what direct primary care is.
It's the easiest thing in the world. It is having a relationship with a doctor, and in exchange for that doctor's expertise and services, you pay them good old-fashioned dollars and cents.
Right. It's maybe the way healthcare was before insurance companies and government got involved, right?
It's how everything works that we go out and purchase. It is how everything works. And when we purchase healthcare services with dollars, access goes up and the cost goes down. Right. Now, the innovation in DPC that puts it into really the modern economy is that most of these practices use a membership or recurring payment model, similar to a Netflix, similar to a gym membership. I can get healthcare on demand by paying, depends where you are in the country, but give or take, $100 a month, I can get all you can access primary care. Now, the big push right now from Freedom HealthWorks is to work with our physicians and say, we can't just react. We can't just say it's healthcare there when you need it. Let's be very proactive. Let's be a partner in people's healthcare journey, because these are the only doctors who are incentivized to get and keep patients healthy. And I think that's a big point to make, that if you're a patient and you see a physician who is employed by a hospital, that hospital doesn't make money on you unless you're sick. There's no incentive for them to actually heal you of your chronic conditions or your diabetes or whatever it is. In our model, the incentive is to keep people healthy.
Right. Let me ask you this. So there'll be people who, because people are conditioned to getting their health care now the way that almost every American gets it, right? With a employer-sponsored health insurance plan. Or if they're 65 or older or retired through Medicare or Medicaid, if they're poor. How do you answer people who would say, well, this sounds dangerous, right? This direct primary care sounds dangerous. What happens if you get cancer or you get some long-term disease? Then what happens? Tell folks how you would respond to that question.
Oh, sure. I'm a firm believer that insurance should be a risk-adjusted financial tool. That's what we use insurance for all the way across, except for health insurance. So if more people opted out and said, look, I'm going to get primary care with a trusted physician. I'm not going to go to the ER for coughs and colds. I'm just going to stay out of urgent care because I'm able to access a doctor. Then we could have the advent of health plans that are a lot friendlier to wallets and friendlier to people's lives. Unfortunately, Obamacare kind of banned those type of catastrophic plans, but there are some free market tools called health shares that we're very, I would say, bullish on. It's basically like a community of people coming together to support each other's medical bills. The early ones were religious affiliated, and now there's a lot of them coming out there that are much more secular. So you don't need a letter from your priest to say, yeah, Chris is XYZ religion over here, whatever it is. And so those are growing up and those are maturing and those are picking up steam. I still believe that there's a use for insurance out there, health insurance out there to cover the big stuff, right? Like you mentioned, cancer and chronic diseases usually can be managed at a primary care level, maybe with the help of specialists. So I'm kind of sideline that one. But I'm going to focus on, and this is another personal story. Most Americans on their big medical expense is usually for maternity. Vast majority of Americans have some type of maternity needs as something that is going to be the most likelihood in any given year. Of course, there's car accidents and there's cancer diagnoses, and those things can get spread out. But, from my standpoint, we had our first baby and we had a high deductible ACA plan because it was the middle of COVID. And my wife was an educator who lost her job when her school shut down and lost her insurance policy. So we went and grabbed a marketplace right away because putting her on our then company policy would have been disastrous financially for company and everything else. And so we had a great pregnancy, great birth, and our deductible was $6,500. We had an HSA. We thought we were doing the right thing. And so then we get the final bill and, shame on us. We didn't look at our out-of-pocket maximum because they took that $6,500, applied it to my wife's care, and then applied it to our infant's care as well. We had like $11,000 out-of-pocket max for a completely normal, healthy birth. We go back and forth with the hospital and insurance company saying, what the heck? Like, you said you covered maternity on this kind of stuff, and they got us, right? So shame on us. So baby number 2 comes and we say, we're not going to do the insurance. We're going to join a health share and we're going to do self-pay. And so I just said, our out-of-pocket max is like 11 grand. We walked into the hospital. We said, hey, we're here for self-pay. We want cash prices on the entire experience. 9 months of OB care plus, and assuming a healthy delivery. And 4 times they tried to get us to go down and sign up for Medicaid. I said, well, wait a minute. You're not hearing me. I had to produce a physical checkbook. I said, I'm going to write the name of the hospital on here. I need you to tell me what the number is to take care of us.
Right.
And once I did that, 20 minutes later, they finally gave me a price. And Jeff, that price was $4,000 less than what we had to pay out of pocket with insurance.
Yeah. Right.
And I'm like, this is nuts. And then our health share kicked in. We paid $1,000 for baby 2 out of pocket.
That's amazing.
By not being
that's
insured.
Incredible. Yeah.
So, when you ask that question, what happens outside the 4 walls? Obviously a long answer. What happens outside of those 4 walls that primary care isn't there? Well, when you're talking to a primary care doctor for an hour, like most DPC practices do, they can do a lot. They're generalists. They can cover a wide breadth of experience and conditions, this kind of stuff. And then they're able to pick up a phone, get you front of line if you do need specialty care, and probably get you a great price. So a lot of our docs joke that they play part-time financial advisor too, because now they are wise and patients are wise that it's not okay to just walk into any hospital or any medical facility, present whatever insurance card you have in your wallet and say, I'll take whatever this gets me.
Right. Yeah. Yeah. So through all this, and that's an incredible story, and your example of the second birth is just amazing. But you and your brother started Freedom HealthWorks. So tell us what Freedom HealthWorks is. What do you do?
We're really a service platform to help get as many physicians into a direct care practice as we possibly can. I know that sounds very wide ranging, but we started really as this incubator to help physicians who say, I can't live with myself going into a hospital, being an employee and being part of the problem. A lot of our physicians that came to us early and wanted to start their own practices with our help said, Chris, I didn't know how bad it was that I was referring patients into the system until I became sick myself. And when doctors become patients and they see the problems that specialty care and surgeries and everything associated with that they're just dumping people into that, they have serious ethical concerns about that and moral issues. They said, I need to start this practice because I'm going to do everything in my power to take care of my patients and not have to refer them on to anybody else. So there was a lot of physicians we talked about this, and they said, well, that's great, but how do I pay payroll taxes? What am I supposed to do about paying my light bills and all this kind of stuff? Typical small business startup that is not easy by any means. I always hear people talk about the fact that, well, doctors are bad business people. And it's not really true. I think most people are bad business people. It's hard to start a business with a lot of the reasons we talked about before, right? A lot of government regulations, a lot of licensing and all this kind of stuff that you never know if you're going to get a nasty letter because you did something which you weren't supposed to, or you didn't have the right forms and files on hand as a business. And so we formed Freedom HealthWorks to help hold doctors' hands and push buttons and pull levers for them, teach them how to start a business, teach them why things are necessary to do this on the business side, ultimately liberating them to focus on caring for patients in their best way possible.
So then from Freedom HealthWorks, Freedom Doc was started because you saw another need. So talk about Freedom Doc and what Freedom Doc does.
There are a lot of physicians that are living paycheck to paycheck. Now, most people might be shocked to hear that, but there's a lot of people out there who went into medicine, have done significantly more schooling, have probably taken on a lot of debt, have never really had a real job. And when they start making serious money, then they take a lot of bad advice and they buy a lot of toys. They get themselves in trouble. Now, I'm not trying to say, hey, that we should all be sympathetic to this, but there's a lot of conditioning that is done in medical schools and residency programs that tee doctors up just to be employees. No residency out there says, hey, independent medicine is alive and real. It's viable, right? So what we ran into was a lot of physicians who wanted to get out of the hospitals were saddled with bad financial decisions or a lot of debt, and they didn't have the ability to create their own businesses. Now, again, I can say that for plumbers. I can say that for electricians. I can say that for all types of careers out there. Not a lot of people do have money to go out and start a new practice. Our model has compressed the need for upfront capital to something that's very much within reach of most doctors out there. Again, pursuing our mission from Freedom HealthWorks to get as many people, as many doctors into direct care as we possibly can, we said, you know what? What happens if we just spooled up these clinics ourselves, if we invested in these practices and then brought a doctor on to set up shop in one of our practices? And so that's what we did. We called it Freedom Doc. We go in, we set everything up, we put our name on the door, and we say, hey, doc, come on in, practice in this facility, get your patient panel established, become a pillar and a piece of the community. And when doctors do that, when doctors go out and participate in community events, it raises a lot of eyebrows, and people are like, holy cow, this kind of feels like those olden days when I actually got to shake my doctor's hand and I got to see the same doctor every single time I went into the office. So it is a completely different experience from the patient side of it, but we try to provide a very soft landing for that doctor who ejects out of employment in the hospital into a practice where they don't have to have an income interruption, yet they can continue to build a very nice, very lucrative, very local physician's practice underneath our brand.
Yeah. So it really frees them up to practice medicine too, right? To not be focused on the business side so much of running a practice and more on the medical and healthcare side of it.
Bingo. Some people out there love to be entrepreneurs and small business owners. Others have shades of both of those, but say, look, I really don't want to mess with paying my, trash bill each month. I don't want to mess with hiring and managing people because that's a totally different skill set. And so when we're able to say, all right, step into this Freedom Doc practice, we've already got your front office person trained and hired. All you got to do is be able to tell people why you are practicing this, can get that final sale, get them as members, and just take great care of them. That's all we're asking of you.
Right. And are those all direct primary care facilities, the Freedom Docs? Are they also all direct primary care, or do you also deal with insurance in those?
They are 100% pure direct primary care.
Gotcha. Okay. So what are you hearing from docs and medical professionals that have switched from kind of an insurance model to a direct primary care model? What do you hear from them?
No matter what, this is kind of direct quotes, kind of paraphrasing and batching things up. No matter what, I will never, ever go back to employed medicine again. Okay. I will never, ever accept insurance or Medicare ever again. If this doesn't work out, I gave it a good shot. I'll go figure out something else to do. But we've been successful. We've had a 97% success rate. And so as far as our practices that we've started from the Freedom HealthWorks, incubator model, working with independent physicians, as well as our Freedom Doc model, we've only lost about 3% of our practices, to going out of business. And those were, some things that we've learned from, from a physician standpoint of what it takes to have a physician who's very successful, what personality traits to look for, and they got to hold up their side of the bargain. And so if any doctor starts a DPC practice, a direct primary care practice, and thinks that just by putting my name on the door or a sign up that people are going to flock to me, it's not going to work. You've got to pound the pavement. You've got to put in hours that show people in your community that, this is what I'm doing. This is why it works for you. And this is how you can trust me, because it all goes back to trust. And that's one thing I think missing in the greater healthcare industry is trust, that we are very, very good at getting, across to patients, but you got to bust through those barriers every once in a while to show that, hey, we are trying to do things the right way. Yeah.
Now, if you mentioned this at the beginning, but if someone has health insurance, it doesn't necessarily mean that they have access to quality care. Explain that a little bit more, what you mean by that.
Yeah. So health insurance doesn't equal health care. The easiest thing to say is, when you get sick, are you going to pick up the phone and call your health insurance company, or do you need to actually call a doctor?
Right.
And most people will kind of laugh and chuckle. Well, no, I need to go see a doctor. Great. Let's start right there with establishing the fact that a doctor provides health care. Now, just because you have health insurance doesn't mean they're going to get you in there when you actually need them. Most people wait 3 weeks to go see a doctor. What good is it if I'm ill, missing work, missing life, unable to spend time with my kids, and I can't get in to see a doctor to help heal me or tell me what I need to do or where I need to go. That's where most people get themselves into trouble, because they delay care or they put off care. And that is a huge, huge problem in the US, because if we're sick, we usually try to tough it out. Sometimes that works, sometimes it doesn't. If we can't tough it out, we go to an urgent care. Urgent cares are great for some things, but others, they're just going to say, wow, you need to go to the ER. Well, wait a minute. Why do I need to go to the ER? I'm not under trauma. I'm not bleeding out of anything. Like what's going on? Why do I need to go see an ER? And most of the time that defaults into that is the fastest way that you will be able to talk with a physician or, a care provider and get your questions answered. And that right there, like that simple client journey, a customer journey, is so backwards of what we came from 3-4 decades ago. And it just, you can see the dollar signs in your mind, like cha-ching, 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 every single step along the way. If you don't seek care and there's actually something really, really wrong with you, boom, huge amount of dollars going to be devoted to getting you back where you need to be. You go to the urgent care, boom, dollars. You go to ER, a lot of dollars right there. And who knows when you're going to get that bill later on. So it's just a lot of question marks and opacity built on one another, where this could be solved if a doctor would actually answer your phone that knew you, knew your history, knew what medications you were on, and able to give the answers right there that you needed it. And then what's even better is not get you to where you're healthy again, but let's figure out how to keep you healthy. Was it something you ate? Was it something environmental? Was it something diet related? Is there something in your genetic history which is going to predispose you to these conditions moving forward? Let's get ahead of it. And that's where a healthcare partnership really comes into effect. And nobody with health insurance has the benefit of achieving that partnership right now. Nobody does. Insurance does not cover it.
Yeah. Now, and let me talk about your podcast a minute, because you have a podcast called Healthcare Americana. What are some of the topics you discuss? I want to give you an opportunity to promote that and tell us how folks can find that podcast.
Yeah, I appreciate that. It started as a way just to tell stories, kind of what I've been doing for most of this episode. I got a lot of stories about this stuff for the last decade of doing this or so. We get to tell stories that give people hope about healthcare. It's not all doom and gloom. It really isn't. I think a lot of people will focus on the negative part of it. And here's the positive part. In the United States, we have the best doctors and nurses out of anywhere in the world, hands down. The problem is the way that we pay for those services. And so with our podcast, we get to talk about people doing innovative things, and not just looking at technology to solve all of our problems, but we talk with doctors who are starting up DPC practices. We're talking with patients who share their stories. We talk about business owners who have implemented direct primary care into their benefits plans as commercially insured plans go. And these people are able to say, look, I get to tell my entire team that not only am I giving them a financial backstop in case things really went bad for their health, but I'm also able to give them and their family a trusted physician that they can talk to immediately if they need it. And then we get to open up stories about how time with a physician enables better mental health care access. We get to talk about how, pediatricians can come in and practice free of insurance and free of government intervention to take care of all the family members, and how complicated kids are and the runny nose, and then they all get runny noses and they could all be completely different illnesses with them. We get to talk about AI in healthcare. And so it's a lot of fun conversations about things that you're not going to read about in the headlines, but are really making a difference in the way doctors and patients experience healthcare in this kind of new healthcare economy that's running parallel to the one that frankly should be on its deathbed. Right.
And folks can find that podcast anywhere you get podcasts or okay, great.
Yep. Anywhere. All of our episodes are up online at healthcareamericana.com. So you see a lot of DPC, a lot of Freedom HealthWorks badging, but there's a lot of cool stuff for everybody. We did some really cool stuff with, new kind of healthcare procedures coming out, and as well as like blockchain in healthcare and democratizing EMRs and EHRs, and people should know what is in their health records. And so it's a lot of fun. It's a lot of wide ranging topics. And every once in a while I get way out over my skis and I'm like, I don't even know what question to ask this guy next, but we get through it and we have a lot of fun with it for sure.
Yeah. Now, how about direct primary care? So lots of folks, I mean, this is kind of a revolutionary thing in a lot of people's minds. Most people who are listening are like, I don't know about that. That's something kind of new, or I don't know if I'd want to try that. If someone wants to try and find a direct primary care provider in their area, their hometown, what's the best way for them to do that?
We put all of our doctors that we work with, we put them up online at our website, freedomhealthworks.com/locations, I believe it is. So there's a mapper right on our website that shows everybody around there. Our company has worked with a little over 150 physicians in about 45 different states. So there's a good chance that we have a client in a locality near you. If we don't, let me know. We'd love to work with physicians and especially show doctors in your area that, look, people want this. People are asking for your services. It's a no-brainer to go ahead and start up a practice. Our Freedom Doc clinics right now, we're only in Indiana. We're looking at expanding those as we understand what the markets are and find physicians who want to operate within a DPC practice and not start their own. So that's a relatively new concept going forward for a lot of doctors out there. So there's a ton of resources. Go to Google, search direct primary care. You might find us. You might find somebody local who's doing it, and then ask questions.
Right.
I think the biggest need from our standpoint is patient demand and patient education. So if you are tired of your typical experience, talking to an employed physician or a hospital physician, frustrated, or feel like you're not getting the attention that you need and deserve, bottom line is there's options out there. You have choices. We just need to help spread the word.
Right. Well, Chris, this is awesome. It's exciting stuff. And again, you mentioned it. I mean, we've got to open up new opportunities, free market opportunities in healthcare, and that will only benefit patients and the healthcare that they get as individuals. So thanks for joining us. I really appreciate your time.
I appreciate it, Jeff. I hope I show that the free market in healthcare is alive and well, and we actually need more of it, not less.
That's right. Man, that's never truer words have been spoken. Thanks, Chris. Appreciate you joining us. And Chris is right. I mean, we've talked about this. We talk all the time about ESAs in education and how that's kind of revolutionizing education in America. And I'm very excited to see where that goes. But healthcare is an area that is overregulated. There's too much government, and government creates barriers. That's what this whole show is about, is pointing out those government-imposed barriers and then helping citizens figure out ways to overcome those government-imposed barriers. And Chris and the great work that they're doing is helping to overcome those barriers. So direct primary care, that's one of the tools in the toolbox, one of the free market reforms in the toolbox of healthcare that you might want to check out and try. So thanks for joining us. Go out there, fight for liberty and freedom. We appreciate you being with us.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.